you once again for joining me on the program, Your Doctor and COVID. I'm Dr. Mahendra Carpen, the Head of Medical Services and Cardiology at the Georgetown Public Hospital Corporation. Today we continue our series of conversations around the COVID-19 pandemic, and we seek to help you understand the impact of this disease on Guyana, on you yourself as an individual. And if you have any questions about COVID-19, please feel free to send us a WhatsApp message to 620-6275 or send an email to docandcovid@gmail.com. I'm very encouraged by the responses we have been getting so far, by the questions that are coming in, and we continue to try to answer these as they come in. As usual, I'll start this off by wearing my mask correctly to cover my nose and mouth, but for the rest of this conversation, I will take it off using the straps so that we could continue this discussion. So we know that COVID-19 has been identified positively in Guyana, and it's been with us since March 2020. And we wanted to look at some epidemiology of this condition as it relates to our local experience, and look at some graphs, etc., that would help us to understand better where we are and where we are going. We need to look at four main areas: the total cases that we have so far, and look at it from a perspective of time, to look at the daily new cases, what is our active case burden like, and the one that is perhaps most grabbing for our attention is the death rates. Other important metric that we should also examine will be things like hospitalization, ICU admission rates, requirement for mechanical ventilation or life support as we know it. Those are also important outcomes to be measured for the COVID-19 pandemic. So let us look specifically at the total cases in Guyana. If one were to examine the total cases as a function of a graph, for example, we see that we started measurement sometime February, March, and there was basically a flat line. There were no real cases identified in terms of numbers. The graph was still at 0. And it gradually started increasing because we were doing 10, 15, 20 tests per day. And then as we got into July, we started to do a few more tests, and the numbers started to increase. And then in August, there was a sharp rise in the number of cases being recognized. And that is a combination essentially of one, the positive cases reaching a critical mass to then infect a lot more persons. So that is a known fact epidemiologically. But then the other thing is that we started doing a lot more testing around that time. So obviously if you're testing more, you will find more. And so that's what happened there. We started finding a lot more cases because we started testing a lot more, and the number of cases in the society would have reached a critical mass to actually explode and infect a lot more persons. The next thing we look at is the number of positive cases daily. So the daily new cases in Guyana, again, in July it started to rise, and it peaked in mid to late September. And we see that after then, there is a trend for the number of new daily cases to start coming down. We are still part of that spike. We haven't reached back to the numbers that we would be comfortable in. Right now, we're still between 30 to 50 cases, new cases per day. If we look at the number of active cases in the society, again, we see the spike starting in June, July, reached a peak in mid to late September, and it's hovering right above there still in October, November. So we still have a number of active cases that is not yet sufficient to make us comfortable in Guyana. The one that grabs our attention most, however, is the total deaths. And we see that our first death was recorded in March, and since then we would have had an increasing number of persons who would have died. The spike actually started happening in September, continued into October, and we're still experiencing an uncomfortable number of deaths per month. But that is not unique to Guyana. That is across the world. This COVID-19 pandemic has unfortunately taken a toll on the most vulnerable among our population, or the population of the world, especially the elderly and those with comorbid conditions. The number one comorbid conditions affected are things like obesity, heart disease, diabetes, etc. All of those we would have discussed previously and will continue to discuss because we are finding out newer things and more information is becoming available to us. So as we continue to answer the questions from viewers and listeners like yourself, we want to be appropriate in the answers. We want to make sure that it sticks to the COVID-19 topic. And one person asked a very simple but important question. And here the question is, should we have mandatory testing of asymptomatic patients? And that's a simple question with significant implications, because the main thing about that is there's an economic consideration. How many tests do we have available, and what does it actually require for us to test everyone in any population? That's a very important thing. So we need to understand a couple of concepts. The first one is mass testing. Mass testing means testing a lot of people. And for this to happen, we need to test all patients with COVID-19 symptoms. That's the first group. The second group is to test all frontline health workers. And the third group is testing in communities where there are already confirmed cases. And we saw some of that in place in Guyana, where we found certain villages that have identified cases, and the Ministry of Health then embarked on mass testing in that particular area. And that's how they're able to find a lot more cases within those same communities that have the COVID-19. Remember, COVID-19 can be spread by three different ways. One is the imported case, that's people coming into your borders who are not resident usually in the country. Then we have cluster spread, which happens generally in our villages. One person or one family become infected, and then all of those around them. And then there is community spread, where it's more than just a household. It is in an entire region, for example, or across the whole country. So it's important to understand those. Now, is it effective to test asymptomatic patients? If we look at a group of obstetric patients that were tested in a specific community, there were about 85% negative admissions for delivery when it comes to COVID-19. And if you look at positives among symptomatic versus asymptomatic, there was a 1.9% positive among those with symptoms. But the scary thing is there was a 13.5% positive in those without symptoms. And therein lies the value of mass testing, because a number of persons without symptoms can actually be carriers because they are positive, and that's the group that can spread it rapidly among the society. Again, if we looked at universal testing versus targeted testing. Targeted testing is essentially those with symptoms. Universal testing is just testing everybody. If we test universally for COVID-19 infection at a community in Maryland, the USA, in long-term care facilities, there were almost 900 residents. There were 25% of that population that were COVID positive, but they had symptoms. There was 31% who were COVID positive without symptoms, and 40% were negative. So almost a third of the persons who were positive did not have any symptoms at all. And when you look at that versus the targeted testing, almost 70% additional persons were found to be positive despite having no symptoms. And that's a very important thing to know. So it's possible to have a lot of positive patients walking around, interacting with others with no symptoms. So ideally, the answer to that question that was posed is yes, we should have universal testing even in asymptomatic persons, but there are specific considerations that have to be taken in place so that we could effectively carry out such a campaign. And one of the main things is resources that are available, whether it's economics or human resources, etc. In countries such as ours, we have to utilize our resources wisely to get the maximum benefit out of what we have. If you look at a prison population, and I know we had some scare in our prison population in Guyana, mass testing finds widespread transmission of COVID-19 in prisons and jail. There were 12 times more cases that were found using mass testing when compared to targeted testing. So if you waited until the persons have symptoms versus testing everyone, you were able to find 12 times more positive persons. And why is widespread testing important? With widespread testing in place, health workers can diagnose the disease early. A patient who is diagnosed earlier could be given care to prevent secondary infections. Community quarantine without widespread testing would still be insufficient in addressing the COVID-19 threat. So it's better to identify these persons who are positive early, isolate, treat, and manage them appropriately before they are able to then spread it to others. Because without symptoms, no one suspects that they actually have anything. When we talk about testing, in Guyana we have one specific way of doing the PCR testing. That is through the nose to the back of the throat. And that can be sometimes uncomfortable for patients. And then there's another way of using through the mouth to the back of the throat. So whatever method is used, some patients may find it uncomfortable, but it is currently the way that we use to take samples for PCR testing. We should have antigen testing readily available anytime now in Guyana, and that will be used specifically to screen patients who are presenting to the hospital. What happens when the sample is actually taken off? It's a very complex process that involves well-trained technicians and physicians to make sure that from the time the sample is taken to the time the result is ready, that it's accurate and it is safely done. There is specimen collection, which is what we do by putting that swab down the nose or the throat. Then the specimen has to be transported to the lab. In the lab, there's a process that does viral inactivation. There is replication of the virus once you inactivate it. and then you run it through a detection sequence in the PCR machine, and then the result is generated for us to know whether the antigen is present or not. And these are the steps in the PCR, or the confirmation testing, that we have available in Guyana. So hopefully this would have answered the question about the usefulness of testing asymptomatic patients. My opinion is that yes, it is something that we should aim for, and we should have more widespread testing. I've always advocated the strategy of test, trace, isolate, and treat, and hopefully we continue to improve on this. So remember, if you have questions, feel free to send us a WhatsApp to 620-6275, or send an email to docandcovid@gmail.com. Thank you very much for joining me again, and do have a pleasant day.